This episode will be exploring some themes around suicide and self-harm. Some listeners may find this discussion distressing, so we do encourage you to practice self-care.
When we look at these prior reports, I wonder, I don't think we'll ever really know why the CDC or other big epidemiological reporting groups specifically exclude Asian American youth. But one thing to think about is there is ample literature showing that the model minority myth really perpetuates a lot of exclusionary behavior, especially in research, where there's this sort of inappropriate assumption that Asian Americans don't have mental health issues, that they don't struggle with suicide, that maybe the population is so small that we shouldn't even worry about them. And that's really problematic, as our report shows that this is actually a huge issue in this community and something that should be looked at. And with the model minority myth, what that alludes to is that this population is high achieving, their well-being is fine, there is no problem here, and let's focus on other groups rather than actually including this group. The other thing to think about is because historically, this was a minority population in terms of sheer population numbers. However, in the last few years, Asian American youth are the fastest growing minority population in the USA. And so that's another thing to think about as future researchers embark on looking at seeing how we can improve research studies on this population and tailor interventions.